Well, good evening, everyone. Thanks for joining us here. We're happy to present our program here about Rowan County and the Spanish flu. My name is Gretchen Witt. I'm the History Room Librarian at the Rowan Public Library. And my co-host is Paul Birkhead, who is Reference Librarian at the South Rowan Regional Branch. And
hello, everyone.
So we first want to let you know that there'll be a question and answer period at the end. So we're going to keep you all muted generally for the program. But there is a chat box open, so if you'd like to share your questions beforehand, please feel free to do that. We are going to record this, so it's recording now, and we'll post that later on our website so that anyone else will be able to take a look at it. We started this researching this information and putting together this slideshow because the county manager asked us to give them the rundown on the last pandemic when we first started encountering the COVID-19 problems. And so it's been an interesting journey to see all of that, and we're hoping that you'll enjoy the program. And at this time, Paul's going to take it away for us.
Thank you, Gretchen. Welcome, everybody, and I hope you're doing well. Thank you for attending. We're going to go ahead and jump to the first slide. I thought perhaps I'd ask you if you'd heard this children's ditty before. I had a little bird, its name was Enza. I opened the window in influenza. That is a little skipping ditty that the kids would sing when they were faced with influenza epidemics in the 19-teens. In 1918, influenza, known by many names, the flu, the grippe, la grippe, this was not new. It appeared to be the same old disease that year, which is caused by a virus, and it usually came around about once or twice a year. The most common symptoms being high fever, runny nose, sore throat, muscle and joint pain, headaches, coughing, and malaise, feeling tired. The virus is transmitted by airborne molecules or contaminated surfaces. That is why wearing a mask and washing hands frequently helped curb the spread of the disease. So that sounds familiar, doesn't it? Some more facts about influenza. There's 4 families of this disease, A, B, C, and D. And A and B are what typically affect humans. There are subtypes of family A, and one of those is H1N1, which caused the 1918 flu and also the swine flu of 2009. Influenza comes around seasonally. We've all probably heard the flu season, and is the cause of much illness and death, especially in the very young and the very old. However, the 1918 strain was particularly virulent, which is harmful or deadly, and affected not only the young and the elderly, but also those in their prime. And what I mean by that is healthy 20 to 40-year-olds. And that was the attribute that raised so many eyebrows and caused so much panic. So why was the flu of 1918 so deadly? And why did it affect those who should have been able to fight it off? Well, that question is still being studied. Some theories have emerged, and the answer may be one of them or a combination. The main one seems to be the worldwide war. World War I was going on. That induced a lot of stress. And physicians will tell you that stress can cause you to be susceptible to illness. Another theory is there is a mutated blended strain of bird and swine flu. So they mixed together this time. This was an interesting theory that I found, and I gave it some weight in my mind. But sometime in their childhood, those of the prime age, those born 1880 to 1900, were exposed to a different type of virus, the H3N8, and their bodies couldn't fight off the H1N1. In fact, because of their youth and overall good health, their immune systems went into overdrive, and that created more problems that their bodies couldn't overcome. So the great influenza pandemic of 1918 lasted for approximately 2 years and affected over 500 million people worldwide. That was 33% of the population then. It's estimated to have killed 50 million people. In the United States, it affected approximately 25% of the population and killed 675,000 people. This epidemic actually reduced life expectancy in America by 12 years. So let that sink in. In North Carolina, reports indicate that 20% of the population was affected, with over 14,000 of its citizens dying. Just like the reasons why the 1918 strain might have been particularly deadly, the origin of the epidemic is also being debated today. Although some say the virus originated in Europe, the beginnings of the pandemic might have actually taken place in March of 1918 at an Army base, Camp Funston, on Fort Riley in Kansas. That part of Kansas also is known for raising hogs. So remember the swine flu, that might have played a part. The first wave in the spring was followed by a second wave in the fall of 1918 that featured a mutated strain exacerbated by mass troop movements across the globe. Remember, World War I is going on. October of 1918 was by far the deadliest month. After about another year of outbreaks and waves, the 1918 flu was mostly gone by December of 1920. And I'll turn it back over to Gretchen.
Okay. Even though we've been generally calling it the flu of 1918 up until now, it was also known by several other names. So you'll find it referred to as the Blue Death. Part of that was because as the victims' lungs filled up with fluid and their extremities and could no longer get any oxygen, so they basically turned purple or a dark blue. So it was called the Blue Death. Other people called it the Spanish Lady. However, for the most part, it was popularly known at the time as the Spanish flu. And this newer version, as Paul said, of the flu attacked the young and healthy. And another factor of this was that it often was extremely rapid in its attack on the victims. Some of them even dying within 48 hours of, coughing 1 minute and dying within 48 hours kind of thing. So why is it called the Spanish flu? Well, in 1918, the Congress passed the Sedition Act. And in order to protect America's participation in World War I. And that meant no one, including the press, could report on anything that would cast a negative light on America and its war efforts, or even any of the allies. And a lot of the allies had the same type of censorship on their press. So reporting on the influenza outbreaks at a U.S. Army installation could be considered a crime. So no one was really announcing that. So during the First World War, Spain was a neutral country, and so its press wasn't censored in the same way. So much of the early reporting that the world heard about the global pandemic came from Spain. And that, coupled with the fact that the King of Spain and some of his court and advisors all came down with the influenza, cemented that the name Spanish flu for us. Now we're just going to briefly look at the influenza timeline as it really appears in Rowan County. So it starts to appear in September and we'll go through these dates, and is roughly gone by January of 1919. So the first time we hear about it in the Salisbury Post is the flu shows up in the Salisbury Post on September 23rd in an article that tells about a quarantine at Camp Sevier, which is in Greenville, South Carolina. There were men from Salisbury and Rowan County and nearby counties, Cabarrus and Stanley and things, that were down at Camp Sevier, training for their role in World War I. Additionally, we had many soldiers from all over the state and even some of the rest of the country traveling through Spencer on the trains to and from different military camps. So, and in fact, in May of 1918, there was a large patriotic event that was planned that took place in Spencer, and Camp Sevier provided one of the bands. So we really did have a relatively close connection with Camp Sevier. And this is a photograph. Well, it takes place a year earlier, but it pretty much gives you a good idea of what the camp looked like. And of course, you can see that there were barracks that the soldiers usually often had to build themselves, and it was very close quarters. And sanitation probably was not the most ideal, and so you have a lot of these. If somebody catches the influenza or comes in with it to the camp, it could quite easily spread, and you can see how that might happen. Now, and Paul's going to tell us a little bit more about the Salisbury Post.
Okay, so there's rumblings about the Spanish flu, but in the paper, there's actually a little ad put out by the Rowan County health officer that, hey, there's some hysteria about this flu, but it's the same old grippe. And remember, grippe is another term for the flu. So in the Salisbury Post, Dr. Warren informs the public about what he knows about this current strain and what he doesn't know. As the virus spreads and mutates, as we're going to see, Dr. Warren's going to change his mind that it's not just the same grippe. Incidentally, the newspaper, and you see we took a little clip for you, they got his name wrong. He's not Dr. J.W. Warren, he's Dr. A.J. Warren, a young man who just graduated from Tulane Medical School. His title is correct. He is the health officer for Rowan County, having begun his duties in Salisbury on January 1st, 1918. So he hasn't been here that long. And in fact, it was a new position created by the County Board of Health, the county commissioners, and the city aldermen under the authority of new state legislation. At the time, most of the counties, Rowan included, did not have a health department. As health officer, Dr. Warren was responsible for educating the public about disease, and he could make recommendations as to what steps should be taken to prevent illness, but that was about it. In the same edition of that paper, when Dr. Warren's saying this may just be the same old grippe, the first cases of Spanish flu are reported in the county. 2 serious cases from East Spencer are talked about, and they even mentioned 2 at the train depot. The article mentioned these men at the depot were traveling through Salisbury on their way home. They were kept isolated at the passenger station and thought to have not exposed anyone to the illness. But still, the railroad brought many people to and through Salisbury those days. The depot, just built 10 years prior to the epidemic, still stands. Here's a slide of that depot. Gretchen?
Okay. So I'm going to talk a little bit now about the depot, but as we said before, there were soldiers traveling through the train station, the train depot, and the Red Cross which of course had mobilized as soon as the country had joined into the war. The Red Cross was mobilized, and a lot of the chapter, the Salisbury chapter here, that's pictured here, were the canteen workers. So they took cigarettes, and remember this is 1918. They took cigarettes and magazines and snacks, candy and fruit baskets and other things that they gave to the servicemen while they were at the train depot waiting for their for their next train. They also raised a lot of money for the national organization to help with the National Red Cross to help with relief efforts across the seas. And we noticed doing our research how many ads were placed in the newspaper for the Red Cross, fundraising and that sort of thing. But as influenza spread, the Red Cross hospitality canteen closed down at the depot in order not to spread the influenza. And we see that as October begins, really the concentration in the state and the state, the county, and the city is still focused on the war. No one's really paying much attention to a quarantine at the military camp, so they're not, they're really not paying a whole lot of attention to that. But by October the 3rd, Raleigh is taking some steps against the influenza. They are, suggesting to limit all kinds of public gatherings. There were 300 cases of influenza, 103 of them just in one day in Raleigh. So, and we have a lot of cases showing up at the state college, 150 of those, and 115 cases at the schools of the blind. Now, there was one school of the blind for white students and the other for the black students, in case you're wondering why there are two schools of the blind in Raleigh. And the cases are already, totaling 265, so they're concerned about this. Now, at this point, there's both the state and the federal government are beginning to publish suggestions about combating the flu and what to do. So we have the one on the right, which is encouraging people, especially doctors and nurses and other caregivers, what we would call caregivers now, to wear masks to prevent the spread of the disease. And as you can see in the other advertisement, they're likening the flu to the war effort. So they, talk about people coughing as just like people spraying bullets on folks. So they are, hoping to slow down the spread of the flu by giving these kind of advertisements in the newspapers. And by October the 5th, the State Board of Health and the United States Public Health Service is saying, all public gatherings are prohibited. And so the public they're closing public offices to the public. Now, by October 5th, the Red Cross in Salisbury is having a meeting, and they're already working on creating an influenza emergency committee. And so, of course, a lot of the women that were already helping at the canteen are prepared to help and willing to help. And so by October the 7th, there's a committee that's formed and appointed in order to help alleviate the epidemic. Now, these men and women that were on this committee did a whole lot of work to help the people. Unfortunately, even though they appealed in the newspaper and to their politicians and legislators, they could not procure any trained nurses anywhere. They just, couldn't find any that weren't already being used. So they relied on volunteers to provide nursing care. The Red Cross, of course, had still been working for the war effort, so that included making masks and linens, and there were all kinds of new meals that needed to be provided, because we were seeing entire families hit by the flu and there is no one there to take care of the people that are sick. The Red Cross did have a couple of soup kitchens, one at the community center, which is now the Rowan Museum. Mrs. J.E. Alexander, who had been in charge of the canteen food, and she remained in charge of the food, providing food for the kitchen, for the folks that needed nutritious meals and that sort of thing, until about October the 16th, which is when it really started to hit hard. And they go from, feeding 60 to people to feeding 2 or 3 times that many. And Mrs. Linton and Miss Olive took over creating and organizing those meals. Miss Olive had been the home demonstrator for the county. So she had been in the county working for the state to show people how to, do things like canning and how to cook properly and nutritiously and those kinds of things. And we also have Mrs. Walter Blackmer, who coordinated linens and masks, and they made the sheets and pillowcases and those kinds of things, and they also made masks for the patients and for doctors and that kind of thing, for Salisbury, for Spencer, for Rowan and Stanley counties. And then they ended up also sending a pattern to Cabarrus County so that they could make those. Now they also had the Salisbury Red Cross Motor Corps, so they delivered meals to many of the afflicted households, and as well as taking volunteer nurses to and from houses. So they would take the nurses in the morning, take meals in the afternoon, and then bring the folks that were nursing back home into town. A lot of the work that they did was in Salisbury, but they did do a lot of work that was in the county as well, in China Grove, Landis, Spencer, and those in some other places as needed. Now this is a photograph from the Library of Congress Red Cross collection of a Red Cross Motor Corps. This is not in Salisbury, but we did have a motor corps, and Mrs. Gregory was in charge of coordinating that, and she coordinated the efforts of the motor corps until her son came down with influenza, and then she appointed Miss Mary Henderson and presumably her daughter, Miss Grace Gregory, to take over for her. So that's kind of the work that all the work that the Salisbury Rowan County Red Cross accomplished in pretty much 4 to 6 weeks time, for October into mid-November. Paul?
All right, as Gretchen said, October was a rough month in the state, in the nation, in Rowan County. So the health board extended the rules, what they called rules, to try to control the spread of the flu. Masks start to make appearances. Streets are disinfected, which I thought was interesting. People complained about the smell, but they hoped that meant it was doing a good job. They really wanted the street, they didn't want them dusty, so they would spray them down, not only with water, but this homemade disinfectant. The Board of Health enacted restrictions according to mandates from the state capitol. People had to limit contact, close businesses early, open all trolley car windows, close schools, churches, theaters, pool halls, other places where people congregated. Federal court was canceled. Drugstores and restaurants were allowed to remain open. But by October 12th, the closings of churches, schools in Moore affected the whole county, whereas before you had municipalities like Spencer had placed their own restrictions earlier. And that may be a good thing because they had the Southern Railway shops out there in Spencer. That's a lot of people out there. Health Officer Dr. A.J. Warren, good old Dr. Warren, and later quarantine officers helped monitor the county. Any household that had the flu had to have a placard in the window or at the entrance so people knew not to enter. Coughing or spreading the virus was likened to warfare. And apparently there was a lot of spitting going on. Several newspaper articles that we read implored folks to stop that nasty habit. But even with these new restrictions, the epidemic was not letting up in the county. And there were several activities and areas that were affected by the flu. And remember, these are big sections of what was happening in the county at the time. One of the things that was interesting was the Sparks Circus came into winter quarters 2 months early due to the rest of their season being canceled because of the influenza. The cotton mills had the decreased production. Salisbury Cotton Mill actually closed in mid-October as the result of so many workers being out sick. Southern Railway shops was also crippled with more than 200 absent at one time due to the illness. Drugstores were just packed to the gills with people coming in for prescriptions, employees working night and day with no relief. The pharmacist of Landis was ill with influenza himself and requested help from Salisbury. A newspaper article said almost every train coming through town carried 1 to 75 corpses. Mayor Burton said parents weren't keeping their kids off the streets and regulations might have to be enforced soon if they didn't comply. Because remember, the schools are closed, so the children are out running around if their parents were too sick or were just letting them run wild. It may be during this time, Gretchen thought, and due to the influenza, that St. John's Lutheran Church changed to individual communion cups. And other churches might have also changed their procedures because of the influenza. Around the third week of October, the flu peaked and began to taper off. Households with the flu, public assemblies, schools, and churches were still restricted, though. Interesting to note that most of the telephone employees were affected, either by being overworked or becoming sick or both. Bell Telephone sent operators from Rowan and Cabarrus to Wilmington because the call service there was crippled early on. Port cities like Wilmington were not surprisingly, they were affected first with all the soldier traffic, people traveling, affected the port cities. So why were the operators sent? Well, in those days, talk about being an essential worker. This is a time where human operators actually had to transfer actual phone calls. So the Surgeon General even appealed to citizens not to use the telephone unless they absolutely had to, so that nurses, doctors, and other healthcare providers could use it if there was a shortage of operators. Also, we've got some clips for you. Companies selling remedies had newspaper ads aimed specifically at those suffering from the flu or wanting to prevent it. Vicks Vapor Rub, their ad blended information about earlier epidemics such as 412 BC and 1889 and touted Vapor Rub's medicinal properties, just like a news article. It was interesting when we were starting to research this that I thought, oh, I've got a great article on Spanish influenza. And I got about halfway through and it was an ad for Vicks Vapor Rub. And we also have Dreco over there. But interesting, Vicks Vapor Rub was first sold in Greensboro, North Carolina in 1905. The Spanish flu made it a household name and it continually sold out. They would even put ads in the paper saying, we're trying to make more. So hang on and we'll get you your Vicks Vapor Rub. So Gretchen, all you.
Okay. Mrs. I just wanted to talk to you a little bit about Miss Lyman Cotten. She was the chairwoman of the Influenza Emergency Committee, and she made a lot of appeals in the newspaper for people to come and volunteer to nurse, and to help out with the Red Cross and the epidemic in general. Her name was Elizabeth Brownrigg Henderson Cotten. She was the sister of Archibald Henderson and the wife of Captain Lyman Cotten, who was a naval officer who was away on duty when the flu came to Salisbury. Of course, she was from here, and she was just instrumental in organizing the Salisbury's Red Cross chapter's response to the epidemic. And she's pictured here with her two sons. This drawing was in the Archibald Henderson collection at the history room here at the library. She was married in 1908, and her sons, Lyman Jr. and John Henderson Cotten, were 8 and 4 at the time of the epidemic. So I'm guessing that it wasn't far, that this drawing is not far off from that time frame. As you can see, she's also pictured to the left, and the captain, Lyman, is also pictured there. She was widowed in 1926, and in 1930, she and her sister, Miss Mary Henderson, still live here in Salisbury. But by 1940, they live in Chapel Hill, and that's where their brother Archibald Henderson was teaching at Chapel Hill, and Elizabeth was a research assistant at the university. So both Captain Lyman Cotten and Elizabeth Cotten are buried at Arlington National Cemetery. Thought that was an interesting thing to know about them. Now, we know at this point in time, it's getting to be the end of October, and we have the Board of Health is reporting that the number of new cases, or the number of cases of influenza, are subsiding. From 3 weeks before, they were like 1,000 cases reported, and then 2 weeks there, within 2 weeks there were only 700 reported, and then in the week of October the 26th, we only see about 450. But they are still being very careful, and they canceled the Halloween festivities, and there was a big fair, the Rowan County, I don't think it was the Rowan County Fair was also canceled at this time. It was apparently a little later in the year than we have it now. But all these, so lots of situations in which there would be a good number of people all together were still being canceled. So they're being very careful even here at the end of the war. Now, on November the 11th, they received notice, of course, that the war is over, and they are planning all kinds of celebrations and parades. And so they just think that, Paul and I enjoyed this first line. It says, "There is going to be some celebration in this man's town this evening, flu or no flu." So they were, so all over the country, there were large gatherings. There was a victory parade in Philadelphia that we know probably spread the Spanish influenza, and there was another pretty heavy wave because of the larger gatherings and that sort of thing. Now, we are continuing on into November. The closing orders are rescinded. The restrictions are eased. But the health officer, as we know, or Dr. Warren, still objects. The Superior Court was convened, and over his objections, he said he didn't think they should do it. It was too soon. But they went ahead and did that. But at the same time that some of these bans were and orders were rescinded, on November the 21st, they also published in the newspapers rules governing management of the flu, and they published in the newspaper and they distributed pamphlets. So they were still, encouraging people to be careful about the flu and not to take it lightly just because they thought they were, over it. By mid-November, the Emergency Influenza Committee kitchen is experiencing, a drop in the need for food production and that sort of thing. So they sort of taper off their soup kitchen activities and that kind of thing. And then the kitchen is eventually closed by the middle of November or so. In fact, the Red Cross goes ahead and publishes their report of all their activities and who helped and all that sort of thing in early December, I think, because they thought maybe the worst of this was over, and they were then planning to that they wouldn't need the activities of the Influenza Emergency Committee anymore. However, Paul's going to tell us differently.
Okay, so the Red Cross has released its report. Obviously, the flu is gone, right? Or they wouldn't have done that. Well, because we are looking through the eyes of history, we can tell you that by mid-December, there's a resurgence of flu in the county. Most likely due to the eased restrictions and the large gatherings celebrating the end of the war. Students had returned to school for only a short while, and then people start getting sick and they're sent home again. Other public places are closed, including churches. We've got the Red Cross Bazaar. They decided, we need to help some more people out. So in this little clipping, it says, the need is urgent now that the influenza sufferers are again to be looked after. So you just know people were frustrated that they thought they had put this Spanish flu behind them, and here it was again. So mid-December, it's getting rough again, but then Christmas rolls around. There's still plenty to celebrate. So just like we're going to celebrate the end of the war, we're going to celebrate Christmas, flu or no flu. But with the help, and we love this picture, with the help of the Red Cross, Christmas is celebrated and Rowan again starts recovery. So the next slide, it shows you on December 26th, it says the influenza ban goes off Thursday. Thank goodness the Rowan County Board of Health lifts the ban. So it's done. After Christmas, we're lifting the ban. People are ready to put 1918 behind them. Can you imagine? But hold that thought, Gretchen.
Hold that thought, right. Although they hold off having the children go back to school. In fact, the schools were closed twice before they eventually close again before Christmas, and they decide not to reopen until January of 1919. But as we see, not surprisingly, there's a new spike in cases of influenza that takes place in January. We get additional appeals for volunteers and for paid nurses to volunteer or to be paid for. And we look at, if we look at some of the death certificates, we notice that while October saw the most deaths from the Spanish influenza, or from pneumonia that was caused by the flu. The totals for January of 1919 are the second highest of the epidemic. So you've got this huge surge in October, then a tapering off in November, December, but then there's a huge spike in January. So again, we see here the appeals by Mrs. Cotten to, for nurses and for, volunteers. I included this photograph of the influenza of we have a ledger from the influenza epidemic in Salisbury of 1920. So we know that this, although it, eases off after January of 1919, we do see it appear again in 1920, and we know that pretty much this strong strain of the flu does take about 2 years to travel and then people become a little, I don't know, more careful or build up antibodies or however that works, but it becomes less than after the 1920. We appreciate you attending our program. We are going to take questions in just a minute or two. So I think Paul's going to take a look at any questions you might have in the chat. And then if we don't have any questions there, we'll unmute. If you have a question that you'd like to ask, just indicate in the chat box that you'd like to be unmuted and share that question with us, and we'll do our best to answer it.
Gretchen, go ahead and put that last slide up.
Okay.
And with Gretchen saying, thanks for coming. This was a fascinating period of history to study. I learned a lot. I wish that I could meet some of the people that had been involved, or at least maybe heard their firsthand accounts. So that's something I took away was maybe if there's events like what we're going through now, maybe put down your experiences about it, and some historian in the future would greatly appreciate it.
Any questions?
All right, so it lasted through 1919 into 1920. Yes. Rowan County, we kind of studied the period through 1919 because that's when that last wave kind of hit. That was the worst. But it does come back, especially in the typical flu season in 1920, and even researching other states. This was part of the Spanish flu that was hanging on. It was the same strain. But 1920 was not, for whatever reason, was not as powerful. People began to be able to recover from it, but that doesn't mean that there weren't fatalities in 1920. So I hope that answered that question. And did it start in Spain? Some debate about that. They don't think it did, but like I said, it might have started here. There's places also in Europe that they think it might have started. But the theory that it started here in Kansas, there's actually a patient 0 that they have attempted to put this, I guess, strain on. So it's interesting to see people arguing about it to this day. But we don't know. All right, so this is for you, Gretchen.
Okay.
Was Mrs. Walter Blackmer related to actor Sidney Blackmer?
Yes. Walter would have been, let me get this straight here. Mrs. Walter would have been his aunt, I believe. But yes, the Walter Blackmers and the Sidney Blackmers were related.
And there's another thing about research in this time period. There's a lot of names that pop up in the newspaper, running for office, being sick with the flu, dying of the flu. That are the names are still around. It's interesting.
Well, I mean, just the Hendersons, the Blackmers, the Gregorys. Mrs. Gregory was the daughter of Senator Lee Overman. So lots of prominent families that were involved in helping the Red Cross particularly.
I don't see anything else, Gretchen.
Well, if that's everything, if no one has any more questions, we sure appreciate you joining us tonight. And we'll see you next time.
Thank you for coming. Everybody stay well.